Very often, when we hear of someone being a scientist, the image that instantly comes to us is that of some bespectacled, absent-minded, but highly intelligent person. We visualize someone out of the ordinary performing extraordinary feats. We also visualize some lonely individuals stuck in the laboratory trying out various experiments day in, day out. Rarely do we think of someone ordinary, very busy doing ordinary things. But this is who Dr. Peter Mwathera is, an ordinary scientist running around doing many things and achieving many results all at one time.
IPL has been in existence for the last 50 plus years. It was set up in 1960, and last year we celebrated our silver jubilee, having been here for 50 years. And as a person from the Department of Reproductive Health and Biology, I'm happy to say that I've been able to come up with 2 medical products.
If you were to meet him along some street for the very first time, you would mistake him for either a business executive or an office manager or even a teacher. The last thing that would come to your mind is that this is a scientist.
I must congratulate you because this was a very, very competitive public award scheme. I'm sure there are many participants.
Thank you very much.
This is really an excellent achievement. I think on behalf of the National Museums, board, staff, management, we really congratulate you for putting the name of the museum.
We have our very own scientist, Dr. Peter Gishoy Mwathera.
Dr. Mwathera is many things all rolled up in one sleeve. From time immemorial, scientists have made important discoveries that have changed the course of history. Yet very few among us are aware that East Africa or Kenya, or Africa for that matter, has produced such pioneers. Kenya has done just that. Dr. Mwathera has developed and researched 3 medical products, namely Smugel, Smuscan, and is in the process of developing another one called Uniprom, which is now patented.
Unbelievable stuff. Doing research with the monkeys and the baboons over there.
The reason why an animal like this could be in its own cage is that if, for example, I'm interested in testing like my product, Unipron, I'm trying to test whether this product can prevent HIV infection and pregnancy. So I want to make sure that everything that happens to this animal, I'm in control of it. Yeah, because if you allow it, like for example, I want it to mate only when I want, when I'm ready to apply the product. Because if it mates outside of the time that I'm supposed to apply the product, then you can't be able to monitor the progress or the success of the product.
Look at the results. 5 years ago, a gel, a scan gel, which he himself patented and invented, if you will. It's called Smuscan. It's available in local pharmacies. And not only that, there's more. One called a Smugel, lubricating gel. You know what that is for. And yet there's another one, folks, that's been patented and being developed as we speak. It's called Unipron. This is what he calls a microbicide. It's the one that could help prevent the spread of HIV and AIDS.
We have been able to develop 2 products that are currently in the market. One of it is called Smugel. Smugel is a lubricating gel that is in use in the market. It is used to address the issue of dryness among women. It is used in hospitals during deliveries and for people who want to lubricate theater equipment. And it's also being used in fertility clinics and family planning clinics. Another product called Smuscan is a gel that is being used in during ultrasound procedures as a gel for scan.
I think the most important thing about lubricants, without going into a lot of details, is their purpose. And other than just the usual for sexual purposes, us as medical personnel, we have a message, and the message is where there is indication for, like where there is sexual difficulties, whether the difficulties is arising from dryness or from some element of disease process or pattern, we need to address it.
Unipron is a microbicidal contraceptive product that we are developing in collaboration with a number of hospitals in Kenya, and I'll be talking about that. And this is a product that we hope can be applied into the genitals to prevent HIV infection at the same time pregnancy. And this will be a very good strategy to empower women so that they can have a system that they can use to prevent HIV infection and pregnancy without consent from the man.
In partnership with Universal Corporation Limited, he has commercialized the two earlier drugs. These products are now on sale in pharmaceutical establishments in Kenya and all over the world.
Just to give you a credentials about Universal, we have been recently awarded with the PIC-S compliant certificate from Europe.
Universal has the capacity to manufacture actually a lot, because if we are going to have it in the government hospitals, we're looking at very big volumes. Like I said, Universal is one of the companies which are WHO certified, and they have a huge capacity. In fact, the challenge is on me, the selling.
Common denominator in every country that has progressed is by investing in its own people. No country, I repeat again, no country will either develop by investing in others. Right. In fact, in history, many countries have developed by investing in themselves and by exploiting other countries. Right. It's true. I don't contribute to the idea of exploiting others, but we can invest in our own people. Take, for example, the drug pharmaceuticals industry. And I'm glad that Universal is here, because it's to consider some of our local-based drug producers. The amount of drugs, medicines consumed in the commercial market is huge. Sometimes if you look at just Kenya alone, the amount of medicines we consume, you young people, you're pharmacists, you're biochemists, you're coming to detail medicines that are produced in other countries. Why can't you set up a system in this country that can produce our own pharmaceuticals that we can consume locally?
Wow, we've got a scientist on the bench, folks. Whoa! And some gel too. And some scanning gel as well. This is made in Kenya. Talk about being all Kenyan. This was done by one of our very own.
Smooth-Gel and Smooth-Scan are lubricants that ease dryness during sexual activity. Uniprom is a human gel that is intended to prevent the spread of HIV and AIDS and STDs, and also a spermicidal to prevent pregnancies from occurring. Uniprom is now at the testing stage. These lubricants are not only important discoveries in the field of human health, but are also important in the reduction of the cost of healthcare, which has skyrocketed to a level that only a few can afford.
We strongly believe as researchers that it is possible for us to reduce the cost of Medicare in this country if we convert our research knowledge into products and ensure that our research products are manufactured locally.
Smooth-Gel is a truly Kenyan product. Smooth-Gel is also manufactured by a local Kenyan manufacturer, Universal, one of the few companies which are WHO certified in Kenya. Smooth-Gel is available in all leading pharmacies and supermarkets. It goes into tins at a price of 200 shillings. Feel confident to use Smooth-Gel. Recommend it to our women so that it can make our sex life more enjoyable. Thank you.
One of them, such as Smooth-Gel, can be described as a woman's best friend, as it helps ease her pain and dryness during sexual activity.
This is smooth gel. This is the product which I was telling you. This is Kenyan product. It was done by a scientist. He's a gynecologist, and it is better than so many other brands I know. Okay, and we agreed. For one reason or another, we get dry, right? We get dry.
The problem with dryness of the vagina is something that all of us, all women, will run into sooner or later. I think it's simple. It's very good. You are visiting different hospitals and showing this, which seems rather easily adapted and hopefully cheap gel. In my country, all women with these problems can buy it without a gel for lubrication. They go to a pharmacy and buy it without prescriptions. Here, I suppose it seems like you have to be in contact with health workers, but that's a very good beginning. And the important thing is that the women should not be afraid of talking about these problems, because they can be very, very handicapping.
In most cases, a scientist invents a product and leaves it to the business community to do the rest. In other cases, a scientist would discover a cure and leave it to others to promote and distribute it. That is not Dr. Mwathera. Dr. Mwathera goes wherever his abilities can take him to talk about the effectiveness of his discoveries. He even distributes some of them as donations to needy hospitals. And in some instances, he reaches out for partnership in order to widen the scope of research and thereafter create a better tomorrow for all of us.
We are making this donation to the hospital, Nakuru Provincial General Hospital. This is as a result of research from the Institute of Primate Research in partnership with Universal Pharmaceutical Corporation. To hand over these medical products. This as a result of research conducted at the Institute of Primate Research in collaboration with a local pharmaceutical company called Universal Corporation Limited, and they are for use by the hospital. Thank you.
Thank you so much for the products. We are really grateful for your support. Thank you for your donations. We appreciate. It's a real blessing to the hospital, because these are products that we have to purchase using our money, but now that we've gotten a donation, it's so good. And we hope to be using them. We find they are good. Thank you so much.
One of the newest and best equipped hospitals in Africa is the new Karen Hospital. It is situated 15 kilometers from Nairobi's business center. This hospital and the Aga Khan have recognized Dr. Mwathera's exhibition to human health, and their management have decided to partner with him to further this course of development of better and more accessible treatment to all of us.
I personally believe that the cost of healthcare in this country is higher than it should. Mainly because our healthcare providers should be able to bring costs down. Just like any other institute is supposed to bring costs down.
Our three pillars are about healthcare, quality healthcare, education and research. And research that which we are discussing today is very crucial. And we believe that part of bringing affordability to quality healthcare is through research.
We discovered or realized that we have overlooked research. And research is actually the backbone of innovative thinking. And with innovative thinking, the sky is the limit. Research is important, and I feel like it's an item that we need to embrace in medicine, so that we begin projecting. As you have said, it's an innovation. You think of something and you want to improve on it, and you feel if you can improve on it, then mankind will be able to benefit even more.
One of the acknowledgements I would want to make, especially to the government, is that for the first time in the history of this country, the government has recognized that the key drivers of this economy is going to be science, innovation and technology. And the government last year appointed a task force specifically to go to the whole country and identify key innovations. The culmination of that is this award.
Some glimpses of Dr. Modera's early life might add some explanation to the reason why he is on his own right such a peculiar scientist. Dr. Gishuhi Modera was born and brought up near the border between Nyeri and Murang'a. In fact, it is the river that separates the two counties. As a young boy, he developed a close relationship with books and also with nature. As a young man, he would from time to time delve into the magical mysteries of nature, always going out to discover more.
When I was doing my A-levels at Moi Forces Academy, and my mom always reminds me this, anytime it rained and there were frogs jumping around our compound in Murang'a Mathira, I would always go after them and start operating on them.
When he was 15, he joined Nanyuki Boys High School in 1979, and later, after 4 years, he was admitted to Moi Forces Academy in Nairobi, where he completed his A-level secondary education. He then joined Kenyatta University, where he furthered his scientific studies in immunology, a discipline that would later dictate his zeal and interest in scientific discoveries that help prevent infection. He completed his master's and doctorate degrees at the University of Bristol in United Kingdom and his postdoctoral training in reproductive health at the University of North Carolina, Chapel Hill, USA. Dr. Gishuhi Modera did his second postdoctoral on test tube baby systems at the University of Leuven in Belgium. He is married with a family. Dr. Modera is at the moment the head of the Department of Reproductive Health and Reproductive Biology in Nairobi. The Fellowship Institute has always brought him closer to primates